Hello. Today we're going to go over Bugs and Drugs 101. This is my basic review on how to learn antibiotics without having to learn every single class and every single antibiotic that exists. The first thing you need to do, though, to understand how to choose antibiotics, you have to know certain examples of major organism classes. So we'll start with gram-positive organisms. The classic gram-positive organisms that you should be thinking about are generally staph and strep. These are common organisms that are found on the skin and soft tissue infections like cellulitis. Another example of a gram-positive organism is Enterococcus. The next type of organism you should have knowledge of certain examples are gram-negative organisms. And you can think of the pneumonic henpeck. This is a mnemonic for examples of gram-negative organisms. The H stands for H. influenza, E is E. coli, N is Neisseria, P is Proteus, E is Enterobacter, and K is Klebsiella. Another gram-negative organism is Pseudomonas. Moving on to anaerobes. The classic example of an anaerobe is Bacteroides. You'll also hear B. fragilis and Clostridium, as in Clostridium difficile, C. diff. Regarding atypicals, examples of atypical organisms are Legionella, Chlamydia, and Mycoplasma, as in Mycoplasma tuberculosis, as in MAC in HIV patients. Now, you do have to also take into consideration some other things before making a recommendation for an antimicrobial. So you want to be thinking about, we already talked about, number one, what organism are you trying to treat? Number two, what is their renal function? So you would need to calculate somebody's creatinine clearance because many times antibiotics need to be dose adjusted for poor renal function. Of course, you also want to know if they have any drug allergies. Other considerations would be drug interactions, pregnancy, you might want to consider frequency of dosing, cost if it's an outpatient decision. So you want to keep these things in mind to help you make antibiotic selections. Now, as I mentioned before, I think it's much easier to learn which antibiotic to recommend if you learn major organism categories, as opposed to learning every single pharmacologic drug category and then memorizing all the antibiotics that exist under it. So I will start off with gram-positive organisms. We'll do gram-negative organisms. We will do MRSA, community-acquired MRSA, Pseudomonas, anaerobes, atypical organisms, and the last category, two more, Enterococcus and ESBL. So we'll start with gram-positive organisms. When you think of gram-positive organisms, you're thinking about staph and strep, right? So think about your cellulitis, your skin and soft tissue. So the classic drugs that you learn that have great gram-positive coverage are beta-lactams. So the original beta-lactam is penicillin. We'll use penicillins really for neurosyphilis. That's pretty much the main place in therapy where we use this. But other beta-lactams include cephalosporins. Now, cephalosporins have different generations. So the best cephalosporins for gram-positive coverage are first generation cephalosporins. The examples of these drugs are cephalexin. If it's IV, it's cefazolin. So as you go from first generation cephalosporins to fourth generation cephalosporins, you start off with great gram-positive coverage, and then you start to lose it, and then you start to gain gram-negative coverage as you move towards fourth generation cephalosporins. Other agents that are good for gram-positive infections are amoxicillin and ampicillin. These two drugs ampicillin is often given 4 times a day. Amoxicillin also can be given, is given at least twice a day, but there are some extended release formulations. But in general, these are the common agents that you would think of when somebody tells you that there's a gram-positive organism, a gram-positive infection going on. Now let's move to gram-negative organisms. So if you have a gram-negative infection, you want to think about classic antibiotics that give great coverage for these bugs. And classically, you'll think about aminoglycosides like gentamicin and tobramycin. You'll also think about fluoroquinolones. Fluoroquinolones like ciprofloxacin, moxifloxacin, levofloxacin. These give you great gram-negative coverage. We also have fourth generation cephalosporin like cefepime. This gives you good broad coverage for gram-negative organisms. You have another cephalosporin. This is third generation. You have ceftriaxone. You'll see this a lot in our hospital. We use ceftriaxone for people with UTIs, and this is an IV formulation. You also have your beta-lactam and beta-lactamase inhibitor combinations like ampicillin sulbactam, piperacillin tazobactam. These are examples of combination beta-lactam and beta-lactamase inhibitor, and these have excellent gram-negative coverage. Moving on to community-acquired MRSA. Community-acquired MRSA was really found in the NFL with the St. Louis Rams in their locker rooms, and where the locker rooms had benches that might not have been wiped down, towels being shared, that kind of thing. And that's where community-acquired MRSA was really first discovered. So you'll usually suspect community-acquired MRSA if a patient gives a history of working out in a gym, in prisons, in close quarters. This is where you can see community-acquired MRSA be prevalent. Now, the way to treat community-acquired MRSA, if you were admitted inpatient, then we would use vancomycin. And if the patient does not need to be hospitalized, we have good outpatient options. And we have good oral options that are cheap, they're available generically, and these antibiotics have been around for quite a while. That's tetracycline, minocycline, trimethoprim sulfamethoxazole, otherwise known as Bactrim. Clindamycin is another good choice, although it is 4 times a day. And we have linezolid, which is it's a very expensive alternative to the others. One other antibiotic I forgot to mention is doxycycline. Now, what I'll say here that's very important is that Bactrim and doxycycline does not cover group A strep. So if you have somebody who is on trimethoprim sulfamethoxazole for a cellulitis, but they don't get better after a few days, then perhaps this person has group A strep. If that's the case, you'll want to switch either to clindamycin. Clindamycin does cover group A strep and MRSA, or you could always add cephalexin to the Bactrim because that also covers group A strep. So I want you to keep that in mind, is that Bactrim and doxycycline do not cover group A strep. Clindamycin does, and if you add cephalexin, that would also work as well. Now moving on to Pseudomonas. Pseudomonas, I pulled that out from the category of gram negatives. It is a gram negative agent, but it deserves its own special category. And so the drugs that are specifically good for covering Pseudomonas include the fluoroquinolones, specifically Cipro. You have aminoglycosides again, usually with a beta-lactam, would cover Pseudomonas. So with a beta-lactam. You have also cefepime here, does specifically cover Pseudomonas, along with other gram negatives, which you'll see is in the gram negative column over here. And then you have another cephalosporin that covers Pseudomonas, and that's ceftazidime. This is a 3rd generation cephalosporin. So this is 4th, this is 3rd. And then lastly, we have the beta-lactam, beta-lactamase inhibitor combination, piperacillin and tazobactam. So these are the drugs that have specific pseudomonal coverage, okay? Moving on to anaerobes. This is a fairly easy category to remember because the list of antibiotics is fairly short, but the most famous antibiotics that are associated with anaerobic coverage is metronidazole and clindamycin. Notice that clindamycin was also in your community-acquired MRSA category. It's great for MRSA and for anaerobic coverage. With metronidazole, you'll have to remember about the disulfiram. Disulfiram reaction. If given with alcohol, the patient will get very sick. Um, Metronidazole is used second line to treat C. difficile. Um, and so, of course, with all antibiotics that you give a patient, you're going to be watchful for C. diff. It can cause antibiotic-associated diarrhea, but then if it turns into C. diff, that would be a concern. So that really applies to all antibiotics. So we have the classic antibiotics here, metronidazole and clindamycin that cover anaerobes, but then you also have cephalosporins that also cover anaerobes. There's two. One is cefotetan and cefoxitin. Now you might see these drugs, GI might be recommending them for SBP or belly bugs. This is where you'll need anaerobic coverage. And then finally, there are some of the combination beta-lactam, beta-lactamase inhibitor combinations do cover anaerobes as well. And that's ampicillin, sulbactam, and piperacillin, tazobactam. Also has some anaerobic coverage. Okay? Then moving on to atypical organisms. The conditions where you're going to hear people talk about atypical organisms would be like walking pneumonia. And in walking pneumonia, you're worried about Legionella. This is the organism you might be thinking about, right? And that was in the previous slide we talked about. And so here, your main go-to drugs are going to be macrolides. And that includes azithromycin, erythromycin, clarithromycin. You'll primarily see azithromycin in combination with a third-generation cephalosporin for empiric treatment of community-acquired pneumonia. But that's pretty much it for this category. The next category, let's talk about Enterococcus. Now, Enterococcus I've pulled out of the gram-positive category because it also deserves its own special column. For Enterococcus, the number one treatment for Enterococcus is ampicillin. The good news is it's cheap. It's been around for a long time. It is multiple times per day. It does come in IV or PO. So oftentimes, if we are empirically treating a patient and we suspect, we want to make sure we cover Enterococcus and gram-negative organisms, then we may give them ampicillin sulbactam, otherwise known as Unicin. This is a beta-lactam, beta-lactamase inhibitor combination that will give you good gram-negative coverage, but also will cover Enterococcus because of the ampicillin. Then we also have vancomycin, also covers Enterococcus. You've all heard of VRE, vancomycin-resistant Enterococcus, and this is, we don't like to go directly to vancomycin if it is sensitive to ampicillin. So keep that in mind. Okay. And then the last category I wanted to go over is ESBL. ESBL is extended spectrum beta-lactamase resistance. So you'll often see this with gram-negative organisms. So you might hear somebody say, this person has an ESBL E. coli or an ESBL Klebsiella. That means that they are resistant generally to cephalosporins. So the main treatment for ESBL gram-negative infections are the carbapenems. So examples would be imipenem, meropenem. These are very broad spectrum antibiotics. They're the big guns. We reserve these for very last line in general when other antibiotics don't work or there's resistance. But specifically for ESBL, carbapenems are the number one treatment for this organism. The thing with imipenem, these drugs can lower the seizure threshold, especially in patients with poor renal function, reduced renal function. So specifically, you want to be cautious in your older adults. So this is a brief summary of how you can learn your antibiotics, your common antibiotics, by just learning these 8 organism classes. I think this is a much easier way to learn your antibiotics as opposed to doing the reverse and memorizing all the antibiotics and then trying to figure out what organisms they cover. I hope you find this video helpful. Take care.